Good morning. I'm Dr. Borromeo. I'm an internal medicine specialist at the Red Lake Hospital.
Hi, I'm Carmen Briones. I'm one of the pediatricians at the Red Lake Hospital.
Hey, I'm Dr. Federico Tinsay. I'm also one of the pediatricians at Red Lake Hospital.
So the CDC has recommended that all persons, when they're going out into social situations, for example, if you're going to the grocery store or you're going to the pharmacy or areas where you're going to be not entirely social distancing, to wear cloth face masks. Cloth face masks in and of themselves do not necessarily prevent you from getting the disease. What we are trying to do, because as we now know, the latest data shows that a significant number of people who may have COVID are asymptomatic. So they don't have symptoms, but you can be at risk of spreading the disease to others. So the cloth face mask helps in preventing you from spreading the disease to others. We would like to stress that still the best way to prevent you from getting COVID is doing the social distancing, so staying 6 feet apart. We're not exactly 6 feet apart, but we're trying to do that. Staying home as much as possible, washing your hands frequently, several times a day, and also disinfecting surfaces that you touch a lot. Because, for example, doorknobs, light switches, those kinds of things, your telephone, all of us now are usually using our phones. So those types of things. And if you need more guidance on that, you can feel free to call us, or you can access that information also at cdc.gov.
And then usually it's like any common areas that you have like a lot of people have used that area or congregated there. So it's recommended that you disinfect that area. And then the other recommendations, like, the ones on your Facebook, there's a posting there, I think a poster that I saw, there was like fly solo. If you can run your errands by yourself without anybody else, that would be great. Go to your doctors, pick up your medicine, go to your grocery store. If you can do it by yourself, that will be a good way to stop the spread as well.
They do recommend that, except for patients who are less than 2 years old. Also for adult patients, for example, who cannot take off that face covering, or who have breathing problems, that might be an issue. They do not recommend using face coverings for those types of patients. The pediatricians may.
I concur.
Especially the young infants.
So the young infants,
Yes.
We
yeah.
need to see how they look and what they're doing,
Yeah.
if they're breathing okay. So
Probably less than 2 years old, it's not recommended.
Yeah. Just like in any illnesses so we always recommend that you go to the nearest facility where you can get tested, where you can get evaluated and treated. So it's going to be the same thing for coronavirus, for COVID. So go wherever is nearest to you. So we're not going to be like, just because you live in Bemidji, we're going to stop you to be seen here. But ideally, go to the nearest place, or nearest facility where you can be taken care of, expedite the cares and everything else. We're not stopping anyone, but this is a facility, a care facility that we provide for all the members. So, yeah.
Yes, we're here to do our job, and that's our job, is to treat people and treat sick patients. So yes, the ambulance will respond to patients if they have tested positive for COVID and are needing care in the hospital. Like Dr. Tinsay mentioned earlier, many or most COVID patients actually recover quite well at home and don't need hospital care. However, if you are tested positive or have symptoms and you need your symptoms are getting worse and you need to be seen in the hospital or admitted to the hospital, our first responders are going to be picking you up to bring you to the hospital.
You know, as of now, based on our medical training, we can only comment on actual evidence-based things, you know, and we have to practice based on evidence and based on our clinical judgment. As Dr. Borromeo says, we don't have any information whether this helps or not, but we encourage you to continue practicing your traditional medicine as long as it does not do any harm.
Yeah. Well, we don't know yet what the medicinal component of these herbs that actually can do to COVID-19. Can it prevent it? Can it cure it? So we don't know yet. So we don't have enough data. I mean, you probably are sick of hearing that we don't have the data to tell you definitely. But yeah, but for now, we don't really have like the data for medicinal benefits of the swamp tea for COVID-19 or any to actually help or even prevent COVID-19. So we're still learning, and then this is part of the learning that we actually need to do.